This is a video demonstration for the instructions for use for the Doppler blood flow monitor. Review key nomenclature. On-off button. Volume button. Channel select button. Extension cable, red connection end with black dot. Silver connection end with red dot. Doppler probe. Cuff. Transducer, braided wire. Retention tab. Channel cable verifier. Red connection end with black dot. Silver connection end with red dot. Push the on-off button to turn the monitor on. Then, press the volume control up and down so that 2 or 3 lights are illuminated. Press the test button. If no tone or beep is heard, maintenance is required. Select the desired channel button to ensure the LED light corresponding to the desired channel is illuminated. Use the channel cable verifier to make sure that the channel you are using is functioning. Trim the curved silicone cuff to accommodate the vessel size. Ensure the transducer assembly is directed toward the targeted vessel. Secure the free ends of the silicone cuff together around the target vessel using appropriate sutures or a clip to maintain the cuff's position. Secure the location of the probe by suturing the braided wire adjacent to the skin incision site, leaving some slack to alleviate tension on the cuff transducer assembly. Loop the remaining wire and suture or tape to the skin. The retention tab may be placed for additional strain relief. Attach the metal connector end of the extension cable into the channel that shows the Doppler monitor is selected. Use the channel cable verifier to make sure that your extension cable is functioning. Attach the proximal red plastic connector of the probe to the distal red plastic connector of the extension cable. Make sure the black dots are aligned. Verify the appropriate position of the Cook-Schwarz Doppler flow probe by adjusting the volume until an adequate audible signal can be heard. If a strong audible signal is not heard, irrigate the crystal with saline at its interface with the blood vessel adventitia. To remove the Cook-Schwarz Doppler flow probe, first free the retention tab and braided wires to the skin by cutting the sutures and/or removing the tape. Remove the probe by applying gentle traction to the braided wires at the skin entry site until the transducer assembly is withdrawn. Examine the distal tip of the probe to ensure that the transducer assembly is present. Note, in the unlikely event that the transducer assembly has become detached and remains in the cuff in the patient, the transducer assembly should be removed surgically. Before cleaning, make sure that the monitor is not connected to a power supply. Do not immerse the unit in solution or allow solution to enter the connector inputs, outputs, or the speaker grill. Be sure that the unit is completely dry and tested following each cleaning and before each use. Do not sterilize. The monitor and the channel cable verifier may be cleaned with a mild detergent or isopropyl alcohol. This concludes the instructions for use for the Doppler blood flow monitor. For complete instructions, contraindications, warnings, precautions, and adverse events, please see the instructions for use that are included with each Doppler blood flow monitor. For more information on the Doppler blood flow monitor, visit cookmedical.eu/Doppler.